Well, let's get more now on our top story, the global spread of the coronavirus, which shows no sign of slowing. In the United States, the total number of cases jumped by 24 over the weekend, and the first 2 deaths from the outbreak were confirmed near Seattle. That's in Washington state on the Pacific coast, adding to signs that the virus is spreading across communities there. Well, let's get more on the situation. Dr. Amesh Adalja is a senior scholar at the Johns Hopkins University Center for Health Security. Thank you so much for joining us here on Global. Your president, Donald Trump, says it is not inevitable that this virus will spread within the United States. Is he right?
No, he's not right. It is inevitable that it's going to spread, and we're already seeing that spread. This is the early stages of a pandemic, so we can expect all countries of the world to have community-based spread of this virus.
And when we look at Washington state, for example, it seems to be spreading within the community faster than was expected. What do you think about the way that the virus is being tracked around the US?
We've had a problem with getting testing scaled up, and this is the result of some kind of bureaucratic issues and some technical issues that happen with the CDC test. But that's rapidly being corrected, and we are going to be able to track this virus much better as testing gets expanded, as all of the 50 states are able to do their own tests, as commercial labs and as hospital labs can make their own tests as well. And what we're going to find is the case count is going to go up, and we're going to find community spread in many different communities across the United States. And that's to be expected and not anything to be alarmed about, because we know this virus spreads very efficiently between human populations, and this is going to be something we're going to be faced with, and we're going to have to get ready for it.
What causes you most concern?
What causes me the most concern is whether or not our hospital systems are able to deal with the medical surge that's going to happen. We know that our hospitals operate near capacity all the time, and some hospitals may be strained when they get a surge of patients, many of whom will have mild illness, but will still put a burden on hospitals in terms of the emergency departments, the intensive care units for the more sick patients, as well as just in general hospital operations. Making sure our hospitals can cope with this, that's the biggest concern I have.
It's interesting, in the last hour or so, I've been listening to the briefing from New York City Mayor Bill de Blasio, who said repeatedly to people who think they may have coronavirus, go to your GP, go to your primary care provider. But here in the UK, we get the opposite advice. Don't go in, phone in and talk to somebody who can give you advice.
What I think the ideal approach is probably the one that you just mentioned, that if you have symptoms and they're mild, you may want to talk to your doctor to let them know that you're sick and to be on, so that they can be on alert and monitor you and check and see if you need any help. But most cases are not going to require hospitalization or even a doctor's visit. Most cases are going to be mild and can be treated with over-the-counter medications. We don't want people unnecessarily to go to the hospital, go to doctor's offices and infect other people in the waiting room. Only if you have medical conditions, if you're elderly, or if you're getting severe symptoms, do you really need to be seen for this? And I think we're going to have that messaging change eventually as we get more cases in the United States.
Do you think people are too scared?
I definitely think people are too scared. It's very hard to strike the right balance during a public health emergency between preparing people and getting them panicked. And it's really important to remember that the vast majority of cases are going to be mild, and it's going to be a difficult time. Not something to panic about. It's not going to be cataclysmic. It's going to be difficult, but we can meet the challenges if we prepare properly and take the right actions.
Amesh Adalja, thank you so much for joining us today. Thank you.
Thanks for having me.
You can find out more about the symptoms of coronavirus and how to protect yourself, as well as getting the very latest statistics on its spread, by downloading the BBC News app or visit our website at bbc.com/news.